What is dry macular degeneration? Now, there are two types of macular degeneration. One is dry and the other is wet. What happens if you have dry macular degeneration? Some patients are really worried if you tell them they have the dry type because there is no treatment for dry macular degeneration. Various pharmaceutical companies have come up with so many nutritional supplements which they sell at extremely high prices, and they tell you that your macular degeneration is not going to worsen if you are on these supplements. But let me tell you, nothing is proven so far, and we have not really seen it prevent the condition getting worse. What you can do is begin to live with it, because once you have a dry type of macular degeneration, with time, there will be a slow atrophy of the macula. So there are drusen deposits under the retina, and these eventually cause atrophy to the area above it. And then we call it a geographical atrophy, which is the last stage of a dry macular degeneration. Once there is atrophy, it means there is death to that tissue in the retina. And once it is dead, it cannot come back. This is not a reversible condition. Vision goes. But the good news is this will affect only the center of the retina, and it's your reading vision, your fine visual acuity, which is going to be affected, and not your overall vision. Vision has an outer component as well. You will be able to walk about, you will be able to do your duties without having to depend on somebody else. Now, just because you have a dry type of macular degeneration, it does not mean that you get so upset about it that I have the dry type and not the wet type. It's not like that. You are lucky that you do not require injections. Yes, the central portion of your retina is going to get affected, and sometimes it may take a decade for it to get atrophied. It may take 2 decades to get atrophied. Don't worry about it. It's exactly like how your aging process is. As you age, there are things in the body which slowly, gradually degenerate, slowly, gradually atrophy. Your hair starts turning gray. Just like that, you develop a macular degeneration. Some patients do develop macular degeneration, and there is a strong genetic component to this. But let us not be disheartened if you have been diagnosed with a dry type of macular degeneration.